Anemia by Kobe, Jade, and Lena. Today we are going to tell you about what red blood cells are, what the functions and productions of red blood cells are, what anemia is, and the pathophysiology of it.
Red blood cells, also known as erythrocytes, take the role of transportation of gases via the protein hemoglobin. Erythrocytes take the shape of small, flattened discs that aid in their ability of gas transportation. Red blood cells are made up of 97% hemoglobin and give them their color. Hemoglobin can transport up to 4 oxygen molecules. Red blood cell cycles. There are two things important in order to produce erythrocytes: iron and B12. When the human body does not have enough of these ingredients, the production of red blood cells is affected and might lead to anemia. Let's talk about red blood cell production. This production is regulated by erythropoietin, which is produced by the kidney. So once the oxygen levels decrease at the tissue level, the kidney releases erythropoietin. This substance increases the proliferation and maturation of the red blood cell. So, let's see what happens. The kidney sense low oxygen levels, and the erythropoietin is released. This hormone acts at the bone marrow level, where the red blood cells are produced in adults. The bone marrow produces a stem cell which, with erythropoietin, will help proliferate and mature in order to become reticulocytes, and will become part of the blood circulation. This reticulocyte will become an erythrocyte within 24 to 48 hours. Approximately 120 days after the erythrocyte becomes old, his ability to morph is decreased and it becomes more fragile, among other factors. So during their normal journey through the body, it arrives to the liver, bone marrow, and spleen, where the phagocytes help to destroy them. Once it goes to the spleen, they are decomposed in globin and hemoglobin. From the globin, we obtain amino acids, which are reutilized, and from hemoglobin, we obtain the hemo group containing iron. These components go to the bone marrow to be reutilized or to be stored in the liver. A small amount of older red blood cells are replaced by new red blood cells every day. Bilirubin is left after the older blood cells are removed. The liver helps break down bilirubin so that it can be removed from the body in the stool.
So what is anemia? It is an abnormally low number of circulating red blood cells or level of hemoglobin, or both, resulting in diminished oxygen carrying capacity. Anemia is not a disease, but an indication of some disease process or alteration in body function. Pathophysiology of anemia. Anemia results from excessive blood loss or destruction of red blood cells, hemolysis, or from deficient red blood cell production because of lack of nutritional elements or bone marrow failure. Anemia caused by blood loss. Once we have a hemorrhage, we lose blood volume. In order to compensate, the body allows extravascular fluid to get into the intravascular fluid, but we also lose red blood cells, which has iron within it. As a result, the oxygen levels decrease, making the kidneys react, releasing erythropoietin in order to increase red blood cell production and compensate the decrease of oxygen levels. Next, the bone marrow, stimulated by the erythropoietin, starts to produce stem cells, which will convert the new red blood cells, but this process takes approximately 5 days. And if the blood loss is not controlled, anemia is imminent. Even if the new red blood cells are successfully produced, they might not have enough iron, which leads to low levels of hemoglobin. With low levels of hemoglobin, the oxygen level cannot return to normal. Hemolytic anemia. Red blood cells are expected to live 120 days. However, in hemolytic anemia, the red blood cells are destroyed and removed from the bloodstream before their normal lifespan of 120 days is over. Anemia can be so mild it goes unnoticed, but symptoms increase as anemia worsens. Some symptoms include fatigue, weakness, pale skin, a fast or irregular heartbeat, shortness of breath, chest pain, dizziness, cognitive problems, cold hands and feet, and a headache. In summary, we talked about anemia, which is the decreased number of red blood cells. The main causes include blood loss, anticipated destruction of red blood cells, and bone marrow failure.